Many anxiety medications take about 4 to 6 weeks to work. But what if I told you there's a treatment that could rewire your anxious brain in just one dose? The FDA recently fast-tracked a psychedelic drug, one that's showing results so powerful it's making traditional anxiety treatments look outdated. Major pharmaceutical companies are investing millions. Clinical trials are happening right now, and the results may well rewrite everything we know about treating anxiety. But there's a catch most women in perimenopause don't know about. Today, I'm breaking down the science behind psychedelic therapy for anxiety, why your changing hormones might make you the perfect candidate, the one critical mistake that could sabotage your results, and what you can do right now while we wait for this breakthrough treatment. Hi, I'm Dr. I'm an integrative psychiatrist and lifestyle medicine physician. Let me tell you about 47-year-old Sarah. For 6 years, she's tried every anxiety medication. Lexapro made her gain weight. Xanax left her feeling foggy. Buspar did absolutely nothing. Nothing touched the racing thoughts that kept her awake at 3 a.m. Her doctor kept saying, give it more time, try higher dose. Then she heard about something called MM120. So what is MM120? This is a pharmaceutical formulation of LSD, lysergide D-tartrate. It was specifically designed for treating generalized anxiety disorder, GAD. It is made by MindMed and designed to be taken as a single oral dose rather than daily pills like traditional anxiety medications. Now, before you think this sounds too good to be true, let me share what the research actually shows. Because what I'm about to tell you challenges everything we've been taught about treating anxiety. In March 2024, the FDA granted Breakthrough Therapy designation to MM120. The FDA offers this designation to speed up the development and review of certain drugs. It is given when early evidence shows the drug could significantly improve treatment for a serious or life-threatening condition. This is designed to help patients gain access to promising new therapies more quickly. MM120 is being tested in phase 3 trials because of its very promising results for anxiety treatment. It represents a new approach, offering relief without daily medication or common withdrawal symptoms. So MM120 isn't your 1960s street drug. This is pharmaceutical-grade medicine, manufactured under strict conditions and tested in rigorous clinical trials. The phase 2 trial results were remarkable. One single dose reduced anxiety symptoms significantly. And here's what was fascinating. Improvement started showing up within 48 hours, not 6 weeks like traditional antidepressants, 2 days. However, what really caught my attention was how long the effects lasted, 12 weeks from a single dose. Think about that. Your current anxiety medication requires daily pills, side effects, withdrawal symptoms if you miss a dose. This treatment, one session, can provide up to 3 months of relief. And unlike street LSD, MM120 didn't cause bad trips. The pharmaceutical-grade formulation was specifically designed to minimize negative experiences. Additionally, the clinical response rates were as high as 70%, and approximately half of the participants achieved clinical remission at the optimal dose. Simply fascinating. Here's what most people don't realize about anxiety disorders. They affect over 40 million adults in the US. That's 1 in 5 people, making it the most common mental disorder in the country. But less than half receive treatment. And for women in perimenopause, the numbers are even more staggering. You're twice as likely to develop anxiety during this transition compared to earlier in life. And your doctor may have told you it's just stress or normal aging. But there's real biology behind what you're experiencing. Now, here's where it gets interesting for women like you. During perimenopause, levels of estrogen and other hormones fluctuate a lot. This results in changes in brain structure, blood flow, and energy utilization. This affects regions for memory, mood, and learning. Researchers view this as a window of opportunity during which the brain can partially recover, reorganize, and adapt. This makes your brain especially sensitive to hormones, sleep, stress, and new habits. And here's the problem. Traditional anxiety medications work by altering brain chemical levels. You take a pill for long enough and it temporarily changes your serotonin levels. The effect wears off after you stop taking the medication. But with psychedelics, they work completely differently. They create entirely new brain pathways. It's like the difference between painting over old wallpaper versus completely renovating the room. Now, if you find value in this information, consider subscribing to this channel so you don't miss future content that could transform your mental health. So how does MM120 work? Your anxious brain gets stuck in negative thought loops, the same worries, the same fears, playing on repeat like a broken record. Scientists believe MM120 breaks down these rigid patterns. It's like hitting the reset button on your brain's operating system. Research shows it increases something called neuroplasticity. That's your brain's ability to form new connections, to literally rewire itself. One study found that a single dose of psychedelics created more new brain connections than months of medications like SSRIs. Here's something fascinating. During the study, the participants stopped taking all other anxiety or mood medications. They also did not receive any counseling. All they got was just one dose of MM120. The study was specifically designed to test MM120 as a standalone treatment for generalized anxiety disorder. So the rapid and long-lasting effect on anxiety symptoms was indeed from just a single dose of MM120, with no other medications or therapy involved during the treatment period. And it worked better than anything they had tried before. But there's something else happening in your perimenopausal brain that makes this even more relevant. Your anxious brain is often an inflamed brain, and perimenopause creates a perfect storm of inflammation. Declining hormones trigger inflammatory pathways, poor sleep increases inflammatory markers, chronic stress floods your system with cortisol. All of this inflammation affects how your brain cells communicate with each other. It slows signal speed, creates neural noise, makes anxiety, depression, and brain fog worse. Traditional anxiety medications don't address this inflammation, but psychedelics, they have powerful anti-inflammatory effects on brain tissue. Several studies have shown that psychedelics significantly reduce inflammatory markers in the brain. Now, before you get too excited, there are some important things to consider. First, this isn't available yet. MM120 is in phase 3 trials. This is the final stage of clinical trials for a new medicine such as MM120 before the FDA can approve it for public use. Second, not everyone is a good candidate. If you have a history of psychosis, bipolar disorder, or certain heart conditions, this treatment might not be safe for you. Third, the treatment requires medical supervision. This isn't something you can do at home. It involves careful screening, preparation, and integration work with trained professionals. Fourth, we do not yet know the long-term effects. While the short-term results are promising, we need more data on the long-term effects of repeated treatments over several years. What can you do while we wait for MM120 to become available? The same principles that make psychedelics effective can be applied to other treatments. Neuroplasticity, your brain's ability to change, can be enhanced naturally. Meditation increases neuroplasticity, so does exercise, learning new skills. Even certain supplements like lion's mane mushroom support new brain connections. The key is combining these approaches with addressing the root causes of your anxiety. Hormone balance is crucial. Declining progesterone during the menopause transition removes your brain's natural calming influence. Progesterone is like your brain's built-in Xanax. When it drops, anxiety could worsen. Erratic estrogen creates mood swings. One day you feel fine, next you're overwhelmed. Elevated cortisol keeps you in a state of fight or flight. Addressing these hormonal imbalances can dramatically reduce anxiety symptoms, sometimes more effectively than medications like SSRIs. Bioidentical hormone therapy, adaptogenic herbs like ashwagandha, stress management techniques, these all work on the same pathways that psychedelics target. Here's another piece of the puzzle most doctors miss. Your anxious brain needs quality sleep to rewire itself. During deep sleep, your brain clears out inflammatory toxins. It consolidates new brain pathways. It resets your stress response system. But anxiety disrupts sleep. Racing thoughts keep you awake. Worry makes you toss and turn. And poor sleep worsens anxiety. It's a vicious cycle that keeps you trapped. Breaking the cycle is crucial for any anxiety treatment to work effectively, whether it's MM120 or natural approaches. That's one more factor that could determine how well psychedelic therapy works for you. Your gut health. Your gut produces 90% of your body's serotonin. If your gut is inflamed, infected, or imbalanced, it affects how your brain responds to treatment. While we wait for MM120, you can start supporting your brain's natural ability to rewire itself. Here are 5 things you can begin to do today. First, reduce inflammation. Cut out processed foods. Add omega-3 rich fish twice a week. Include colorful vegetables at every meal. Consider curcumin supplements. Second, Support neuroplasticity. Try meditating for just 10 minutes a day. Learn something new. Challenge your brain with novel experiences. Take up a musical instrument or learn a language. Third, balance your hormones. Work with a practitioner who understands perimenopause and menopause. Consider bioidentical hormones if appropriate. Use adaptogenic herbs to support your stress response. Examples are ashwagandha and rhodiola. Fourth, prioritize sleep. Create a cool, dark environment. Limit screens 2 hours before bed. Consider magnesium glycinate 400 milligrams at bedtime for deeper rest. Fifth, heal your gut. Eliminate inflammatory foods. Add fermented foods like kefir and sauerkraut. Consider a high-quality probiotic. To find out exactly how to heal your gut and the critical mistake that's sabotaging your results, check out this next video.